Hi, I'm Dr. Douglas Harrington. I'm the Chairman and Medical Director for the GUARDaHEART Foundation, and we're here at the Church of Jesus Christ of Latter-day Saints in Chino Hills. And today we're doing no-cost COVID testing, antibody testing. You can register online. We're also doing a pulse cardiac test, which identifies damage to the lining of your arteries, which is one of the consequences of COVID infections. It's a major consequence, which is why the heart, the brain, the lungs, the liver, the kidneys are most damaged by these infections. Now, the importance of doing antibody testing is that it gives your public health authorities an idea of what the true prevalence of the disease is in the community, and it also allows us to identify areas where there might need to be an intervention if there's an extremely high prevalence rate or level of the antibodies. The other thing it does is it tells the individual who has antibodies that they have some level of immunity, and that's a good thing because it means you're somewhat protected from the virus, and all the latest evidence is suggesting that that immunity is very durable and very protective. So we hope that you will come out here and get tested. And today we are also offering the pulse cardiac test as part of the program. And the pulse cardiac test was developed to identify those people, which is the majority of people, who are at risk of having a heart attack and don't know it. And it does that by measuring damage to the lining of your arteries. So it's like the earliest signal for coronary artery disease. Well, it turns out that the coronavirus, the COVID-19 virus, selectively binds to the lining of your arteries and damages it. And the pulse cardiac test can measure that damage, and therefore it's potentially an important predictor of severe damage, which would predispose individuals to what we're seeing here, which is heart attacks, strokes, and blood clots in patients less than 50 years of age. It's due to that damage to the lining of the arteries. So please feel free to request the pulse cardiac test when you're here. And the pulse cardiac test is available throughout the country. You can ask your doctor about it, and if you don't have access to it, go to www.pulsetest.com, and you'll get a wealth of information and links to request a doctor. So the good news is that the vaccine rollout has been going very smoothly, and I think it's a credit to the scientific community and the government that they were able to sponsor Operation Warp Speed and develop antibodies within develop vaccines within a 6-month period, which has never been done before. And it turns out that the level of effectiveness of these vaccines was deemed to be at least 60%. The ones that were first released, the Pfizer and the Moderna, were at least 94% effective. And this is extremely critical to achieving a level of herd immunity in the community. So the actual number of complications from the vaccinations has not exceeded what we see with other sorts of vaccines. So we want to encourage all of you who are eligible to go out and get vaccinated. The CDC currently recommends that even if you've had it in the past, that you should still get vaccinated. There is some concern in the medical community that you probably only need one shot instead of 2 if you've had it before. The other people that should be getting it are clearly the people that are high risk and first-line responders right now, but I believe within a month they're going to open it up to everyone. And so I encourage you to get it. One of the things that you can do to determine if the vaccine was effective is look for antibodies. Currently, the CDC does not recommend measuring antibodies post-vaccination, but a number of health authorities are doing that just to determine whether they can see if the vaccinations are effective. And what I want to state for everybody is that not everybody responds to the vaccine at the same rate. In the clinical trials, the peak antibody levels occurred 1 to 2 weeks after the second dose of the vaccine. But in elderly people, people who are immune compromised, and even some young people, the development of antibodies can take a little bit longer. And so don't be worried if you've been vaccinated and you don't see antibodies yet. You can check them later. And we do have some new tests coming out that will be specific for antibodies related to the vaccines. So look forward to them in a couple of weeks. Okay?